let's talk about a part of the body we all have, but probably don't think about too much: the armpit. I mean, it seems like just a hollow space, right? Well, it turns out it's actually one of the busiest, most important intersections in your entire body. So, we're going to dive in and find out why this simple spot is so incredibly important. You know that moment during a checkup? The doctor gently presses into your armpits? It can seem a little bit weird, but there is a super important reason they do that. And by the end of this, you'll know exactly what they're looking for and why that simple check is a big deal for your health. So, first things first, what even is an armpit, medically speaking? It's not just a fold of skin. No, it's a very specifically built space with a proper name, a certain shape, and a huge job to do. Okay, so the official medical term is the axilla, and what's really cool is its shape. You can think of it as a four-sided pyramid, a real three-dimensional space, kind of tucked right there between your upper arm and your chest. All right, so if it's a pyramid-shaped room, what are the walls made of? And what about the floor and the ceiling? Let's take a quick tour and map out the whole thing. So take a look. The very top of that pyramid, which is called the apex, is actually an opening. It's a passageway that connects all the way up into your neck. And the wide bottom of the pyramid, the base, that's the skin of your armpit, the part you can actually touch. Now for the walls, the front wall is made by your big chest muscle. The back wall, that's your shoulder blade and some of the muscles around it. The inner wall, the one closest to your body, that's your rib cage. And finally, the outer wall is your upper arm bone. So, see, it's completely walled in by bone and muscle. Okay, now that we know the shape of this little room, let's talk about what's inside it. Because this is no empty room. It's more like a grand central station for some really, really important stuff in your body. So you've got some major players passing through here. You've got the main blood pipes, the artery and the vein, that supply your entire arm with blood. You've got a whole bundle of nerves that controls every movement and feeling in your arm and hand. And then you have these things called lymph nodes, which are like tiny little filters for your body's defense system. So the main takeaway here is that the armpit is this protected tunnel. It's a junction box that lets the lifeline of blood and nerve signals travel safely from your body out into your arm. I mean, without this space, your arm just wouldn't work. Now, of all the things packed inside the armpit, the ones that matter most for that doctor's checkup are the lymph nodes. So let's zoom in on these little guys and really understand what they do. Your body has this fluid called lymph, and its job is to travel around collecting waste and fighting off germs. The lymph nodes are basically security checkpoints. They're these small, bean-shaped glands that act as filters, trapping things like bacteria and viruses so your immune system can take care of them. Okay, now here's a number that connects everything we've been talking about: 75%. So why is this one number so important? Well, it's because about 3/4 of all that cleanup fluid from the breast drains directly into those lymph nodes in the armpit. This makes a direct highway between the health of the breast and what's going on in the armpit. It's the very first stop for fluid leaving that area. So let's put all the pieces together and get back to our original question. Why do doctors check this area so carefully? When everything's going well, your lymph nodes are small and soft, and you really can't feel them. But if they're fighting an infection or something else is going on, they can get swollen, feel firm, and become much easier to feel. That change in size and texture is exactly what a doctor is looking for. A swollen lymph node is a signal. A lot of the time, it just means your body's doing its job, fighting off something simple like a cold. But because of that really strong connection to the breast, it can also be one of the very first signs that cancer cells have been caught in that filter as they're trying to move. And this is especially crucial because we know that the part of the breast that's closest to the armpit, the upper outer part, is also the most common place for cancer to start. That makes checking those nearby lymph nodes an absolutely vital tool for catching problems early. Whew, okay. That was a lot of information packed into a small space, kind of like the armpit itself. So let's do a really quick recap of the main things to remember. Okay, to sum it all up. First, your armpit is a structured pyramid-shaped room. Second, it's a super important highway for the blood vessels and nerves that make your arm work. Third, it's filled with lymph nodes that act as filters, especially for fluid coming from the breast. And fourth, that's why doctors check them, because a change in those nodes can be an early warning sign from your body. And there you have it. The armpit is so much more than an empty space. It's a brilliant piece of engineering, a junction box, a highway, and a security checkpoint all in one. It just goes to show you, even the simplest parts of our bodies have the most complex and amazing stories to tell.